I'm Muriel Bowser. I'm the mayor of Washington, D.C. And this morning, I'm here to provide a brief update on the district's response to COVID-19 and then be available to answer questions related to COVID and more general questions. This morning, we reported 30 new cases of COVID-19 in our community. Unfortunately, we did not report any additional lives lost since last Wednesday. And before you, we are showing the metrics you can find at coronavirus.dc.gov related to community spread, testing, healthcare capacity, and contact tracing. I also want to share with you our testing locations for this week. Previously, the same engines were available, fire engine companies, I should say, for 3 days in a row, but now we have broken up those groups. So instead of being available Monday, Tuesday, and Wednesday at the same stations, they're now available Monday, Wednesday, Friday, and so forth for the engine companies that were available Thursday through Saturday. So please consult coronavirus.dc.gov for that updated cadence of scheduling. This weekend, I was also out with the leadership of DC Water as well as members of my team to speak with residents concerning the flooding damage experienced in the Edgewood and Riggs Park neighborhoods following the very significant rain event on Thursday. So we want to continue to remind residents to go to wastewater.com to learn more about the backflow valve rebate program and also filing a claim for damages. Residents who experienced flooding and other storm-related damage during last week's storm are encouraged to file a claim at dcwater.com. We also continue to remind our small and local businesses that the application period for a Great Streets program is still open. And through Great Streets, the brick and mortar businesses located in Great Streets corridor can receive up to $50,000. The funds can be used for storefront renovations, equipment purchases, and technology enhancements. Businesses can learn more and sign up for an information session on Tuesday, September 15th at greatstreetsdc.gov. I also want to continue to call attention to the availability of internet support through our Internet for All program. Last week, we announced that through this program, 25,000 district families who qualify will get free high-speed internet access. Eligibility includes households that are currently receiving SNAP and TANF benefits and have a child enrolled in a DC public school or DC public charter school. For more information, please go to techtogether.dc.gov to learn more and to fill out an application. Finally, Dr. Nesbitt and I are joined by Faith Gibson Hubbard, who is spearheading our efforts for our annual Maternal and Infant Health Summit, which kicks off tomorrow. This will be a virtual summit with sessions Tuesday through Friday, and anyone interested in learning more can find the full summit agenda at dcmaternalhealth.com. So with that, we'll be available for your questions. Yes.
Since we talked about the extended unemployment benefits last week, that many states have started to raise concerns that the money is going to run out and they're not going to be able to provide the benefits that they hope. Do you have any revised expectations for DC residents about what they can expect in terms of the $300 extra that's supposed to be coming in?
I will, and perhaps Dr. Rodriguez can, who is also behind me, I explained last week, and Dr. Rodriguez will be able to tell us about the full pot available. But the president, as you know, announced a different way to pay for the additional unemployment payment that residents had been receiving. I'll just remind you, there's the traditional unemployment that our unemployment trust fund pays for. Employees pay into it, and when their claims, that trust fund is tapped. For COVID, the U.S. government, the House of Representatives, the Senate, and the President passed I don't want to call it a bonus payment, but it's on top of traditional unemployment, and that was $600. And that program expired, I think, at the end of July. So now the president has come up with another executive program that taps into FEMA funds for lost wages. And the lost wages program will pay $300 if the state can show that it has already paid $100 or a $100 match. And that is also limited. And I don't know, Chris, do you know all the parameters of the start and finish of that? Let me have Chris Rodriguez come up.
Yep, thank you, Mayor. And what the mayor was referring to is the president tapped the Disaster Relief Fund, which is the primary FEMA fund that is used to provide assistance after major disasters across the country. That fund, I believe as of last week, had about $96 billion in it. And I believe the other needs assistance lost wages program is capped at $44 billion. And so that is the threshold that the White House and the Congress are using. So once that program exceeds $44 billion is when they will stop administering those programs. So I think a lot of the stories that you've seen is sort of folks anticipating that program will reach that $44 billion threshold. We don't know when it's going to do that, but we generally speaking, because some of the states haven't implemented the program yet. So I think that's what you're seeing being reported.
Yes, sir, James.
Mayor Bowser, in terms of the flooding that took place on Thursday, that area historically has had problems with flooding. And while this isn't a Bowser administration problem, it may be a problem for the U.S. Army Corps of Engineers. Has your team consulted with whoever you need to consult with in order to solve I think it's a geology problem in that particular area in terms of flooding?
Well, I'm not sure about your assessment yet, because DC Water still needs to do an after action report. And that's what I have asked them to do so that I am fully aware what the problem is. Is this a historical problem for that neighborhood? Some residents report yes. Is it an issue with the storm? Is it an issue with their system? But bottom line, what can we do about it? So one of the first things that DC Water has committed to, which we know can help, is the back, and I don't want to get the name of the program wrong because it's a specific program, but the backwater valve rebate program, which can prevent sewage from coming up in the house. So those neighbors, those affected neighborhoods should go to wastewater.gov for more information about that program. And then what I hope to be able to learn from DC Water this week, and I expect to have more conversations with them, is when they expect the after action to be complete. Our own team at HCEMA will help in reviewing that after action so we know what exactly happened and what we can do to help prevent neighbors from going through what they experience, which all of us can empathize and imagine how disturbing a situation that is to have water and sewage back up in your home. Yes.
For the many residents who are concerned about DC Water and their insurance not being able to help them financially. Is your office committing to assist them with those other costs that they're not able to pay for?
I don't really know what is not going to be covered. So that's part of what I'm falling into something as I speak on the floor. We need to learn more. Yes. Thank you, Chris.
Tom Rossi, Channel 7 Mayor. Following up on that question, if everything is not covered for them, will the city commit?
If, let's not speculate. Let's deal with facts.
I talked to residents this morning that are very concerned that they don't.
We're all concerned, and so we still have to deal with facts. And so that's why DC Water needs to do some research. We need to consult with them on what they have found, and residents also need to work on with their insurance companies and filing a claim with DC Water. So I don't want us to jump to Z when we're still at B, and that's what we have to learn.
Well, they tell me they've already heard from insurance they're not going to get covered, and they're very concerned DC Water is going to reject them. So they're really worried right now. Do you have any words of assurance for them?
I don't have anything more to say about, we still have to go through all of the steps to understand what happened and how we can be of most help. So over yesterday, we sent teams out to make sure that we have heard from residents and that residents can get in contact with us by completing a survey with our Homeland Security Agency. So I recommend that they look at those materials. DC Water has also committed to publishing a frequently asked questions so everybody can review those questions. And then I'm not sure if they've announced yet, but they will do a virtual town hall so that they will be directly available for questions.
Is there any kind of timeline to when you'd like these questions to be answered and when you might?
I would like the frequently asked questions to get out today. And I think they're working on having that done. And I think they're going to plan a town hall this week.
And what about a timeline to DC Water's review of the claims?
I can't say that without knowing the full scope of what's happening. But obviously, I would expect them to work expeditiously. Yes.
Mayor Bowser and Dr. Nesbitt, is there a concern of COVID being transmitted from sewage that is backing up into people's homes? And Dr. Nesbitt, are you privy to the data that DC Water is collecting on COVID for Howard University for their study? And if so, can you share any of that with us?
So I won't share anything that is being used from a preliminary perspective in terms of the ability to rely on wastewater data as a method of supplementing surveillance efforts for COVID. What some people, and I think what you're referencing, Mark, you can correct me if I'm not tracking your question, is the ability to detect COVID or levels of SARS-CoV-2 virus in wastewater. And that is possible because when some studies have been done internationally in a number of countries, the SARS-CoV-2 virus can be detected in a number of bodily fluids. Although that may be true, and we're still trying to understand how useful wastewater data is as a supplement to surveillance efforts, it is not a replacement for the data that we have from the antigen test and PCR tests that are used to detect the presence of SARS-CoV-2 virus from the respiratory tract. It supplements that data. We do know that the primary method of transmission of the virus is through respiratory particles. So I would not have concerns at this point that there is active virus that has the ability to transmit the virus in wastewater. Again, we need to be mindful that the primary mode of transmission of the SARS-CoV-2 virus is through the respiratory particles.
So I think the very end of your statement is what I was actually trying to ask about. So
Yes.
These people who have had sewage backing up into their homes, particularly people who might have high-risk family members in those homes, they should not be concerned that COVID...
Correct. The primary mode of transmission of the SARS-CoV-2 virus remains to be through the respiratory droplets.
Any other questions? Yes, ma'am.
Nesbitt, you've talked a lot about how we need to get to a point where our cases are clustered and related to each other, and it seems that that metric hasn't moved very much. I just wanted to check in again and ask what we're doing as residents, as government, that can move us toward getting somewhere on that metric.
Well, I'm pleased to hear you, Julie, say as residents, and not just as what is the government, the public health agency doing to help us move in that direction. And we've given a lot of context for that in terms of ensuring that people are engaged in our efforts. So, you know, to what extent are we having people wear masks when they go out and wear masks properly when they go out? Having a mask around your neck or only around your mouth and not covering your nose is not what we're looking for in terms of having people wear masks properly. Continuing to have people not be out in public if they are not in their usual state of health. So we've transitioned away from having people think about, do I have fever, do I have cough, do I have shortness of breath, those signs and symptoms of COVID that we introduced very early in the pandemic. We know that some people can have simply just body aches and headache, or for small children or older adults and seniors, loss of appetite. Being very aware of them being the initial signs and symptoms of COVID that you have. And if you have those signs and symptoms, do not go to work. Do not go to social events, even if they're just small things at your sister's home or at your parents' home. Those are the things that are going to help us disrupt these chains of infections. So that adds to the third thing about choosing your activities wisely. Although we have turned on some activities in the District of Columbia, it doesn't mean that you should go to all of those activities every single day or multiple times in a week. And there's ways that you could be supportive of some of those businesses, if that is your goal, is to be able to support those entities. You can still do them by being mindful of the type of activities that you're participating in. So we really have to be able to do those types of things to be able to reduce the amount of new cases that we have citywide. And as we reduce the amount of cases that we have citywide, we'll eventually get to where we only have clusters.
But is anything going to change? We've sort of been at this point for many, many weeks now where we've had the same activities open. We've had sort of a plateau in cases.
How we behave changes that, Julie. There's nothing I, as the individual health director, can do to modify that.
And as Virginia and Maryland open more activities in their phase 3, is that going to affect us here?
Well, I think you've noted that there's been the opportunity, especially in Maryland, for the counties to activate some activities, but in my conversations with those local health officials, they have not necessarily activated those particular activities.
Okay, we'll take a few more. Yes.
A question maybe for Director Rodriguez about testing sites and their capacity. This morning, for the second time that I've seen in the past week, F Street closed at 10 o'clock, and it's listed as being open until noon. And what they were telling people this morning as they turned them away is that they're being limited to a smaller number of tests now to 300 tests per day, at least at that site. And so I'm wondering if the number of tests given per sites is going down, if demand is going up, or just what you're seeing, why, at least anecdotally, we're seeing some sites closing early, turning people away.
So Mark, what we've seen is continued strong demand for our mass testing sites. As you know, we had some weather events last week, which caused us to shut down some of those sites due to weather. What I'll do is I will get briefed on the F Street location after this and report back.
But are the testing sites getting the same number of tests this week that they were getting a few weeks ago? Has it always been?
There are no issues at this time with our testing capacity. Our ability to test all those who come up and don't have an appointment.
Well, I guess my question is, how many tests are each site given every day? Are they given the same number every day? And has it always been that same number?
Well, it does depend on some of the trends, right? So, for example, our mass testing sites will have larger flows than, in some cases, our firehouses. So we can get you those specific numbers. Yeah.
Yes.
Mayor, I have a question for you first and then for Dr. Nesbitt on schools after. In regards to reporting that DC did not meet the 14-day metric before moving to phase 2, can you explain why a staffer was reported as requesting that information on a recent peak be withheld from posting online 2 days before the city moved into phase 2, and then why that information was permitted to be posted but then quickly removed?
I'm pretty sure we covered this at the time. Your question is, why what?
This is in regards to reporting that DC technically did not meet the 14-day metric before moving into phase 2.
We know that. That's not news. And we talked about it at the time, where we had achieved 13 days. And I think that Monday we went into phase 2 at 13 days and maybe hit 14 days the next day, something like that. And I explained then it was my decision to move forward.
Is there information, though, on why there's reporting that a staffer in your office had requested that information be withheld from posting online on the data set 2 days before the city had moved into phase?
I don't know about why anything would be withheld, and I'm sure it was posted.
Dr. Nesbitt, a question for you, please.
What's your question?
The question is about the discussion at the last news conference about wanting to move into in-person instruction sooner than later.
Yeah.
With regards to concerns raised by DC Nurses Association.
Raised by whom?
The DC Nurses Association, that they had asked to meet with Dr. Nesbitt, and they're raising concerns about what policies are put in place in terms of the nurses' roles at the school, who will be doing temperature checks and whatnot. Has any of that been addressed, and has there been a meeting with the DC Nurses Association?
I'm not sure, but we constantly talk to all of the unions representing our employees, and we will continue to do that throughout COVID. I think you recognize that we have more than 30,000 people who work for us. Some of those workers are working from home, and others are reporting to work each day, like all of the employees that you see here. Some of them are represented by unions, and some of them are not. But the bottom line is that our employees will be asked to do their jobs and to serve the residents of the District of Columbia. And we are working very diligently to make sure that we can support conditions where they feel confident.
Thank you.
Yes, last question.
Can I ask you about your maternal summit?
Yes.
Summit? And I know this is something that, is kind of, for lack of a better term, your baby. I mean, it's something that can you talk about the challenges and the importance of it in this virtual climate? I guess you're doing it virtually, and I'm kind of thinking back to just kind of how hard it was to follow Princess Bride last night.
To follow what?
The Princess Bride reading was done by Zoom, and it was kind of an example of getting a big conference together with people, and it doesn't flow like it would normally in person. So I'm just wondering how you're going to ensure it kind of rolls out smoothly, and just the importance of attending it in a virtual COVID environment.
Well, Dr. Nesbitt wants to say something, so I'm going to get out of the way for Dr. Nesbitt and Dr. Faith Gibson Hubbard to address that. I may have a final thought.
So, Mark, I won't speak about the content of it, but the spirit of your question compelled me to be like, Mayor, I want to say something about that. I've been working on this response for about 8 months, and during this time, there's always a host of public health meetings and medical conferences, et cetera, that are planned. And I would take the time to commit in my schedule throughout my career to attend 1 or 2 of those conferences because I have, I'm a licensed physician, I do this work, and I have a responsibility to be a lifelong learner in this environment. And I will tell you that when I participated in the National Medical Association's annual meeting and scientific assembly, I found myself more engaged this year in the virtual meeting than in past meetings. And I believe that the content even was more focused than in past times. And the ability to be able to move in and out of sessions without having to shuffle around large conference rooms, et cetera, and the ability that people really are focused on learning, health professionals, clinicians, community-based organizations, their commitment at this time right now in our nation to learn as much as they possibly can, to provide the best care to their patients, to their clients, to be responsible in providing the most information they can to the communities they have the responsibility to serve, is at an all-time high. And many of the conventions and conferences that have been shifted to be on a virtual platform have an ultimate responsibility and dedication to serve these folks, and are seeing record and unexpected enrollment and participation in their sessions. So I can tell you, as someone who has participated in both, the ability to focus and the ability to gain information to really experience the goals and objectives of the session is not compromised by the format. Now, I'll tell you, next year, we expect to be able to be in an in-person format, to be able to support all of the types of industries and sectors that are part of hosting an in-person experience. I don't think that we expect to have this be a virtual type of summit in perpetuity, but having to work under these types of conditions because the pandemic requires it will not compromise the integrity of the summit, the goals and objectives of the summit, and people who are dedicated to providing the best resources to their constituencies that they serve will show up and will be able to gain what they can and what they are expected to gain from this summit. And I know Faith, who will speak next, will tell you that she has gone above and beyond this year to meet all of the goals and objectives that we expect at this conference to be able to bring to the residents and to the nation in its third year.
So thank you, Mayor Bowser, and also thank you, Dr. Nesbitt, for that passionate response, because that's exactly right. This year, we've already doubled the amount of RSVPs for the summit. In years past, we've been at about 3,000 RSVPs, and then about anywhere between 1,500 folks appear. Last year, we also had a significant amount of streaming views, which let us know that 3,500 streaming views last year, which let us know that people were hungry for the content. This year, we have 6,500 RSVPs already, and we have extended it to 4 days of events, and people are very, very excited. It allows us to take the work that we're doing here in the District of Columbia, the vision of the mayor, the work of Dr. Nesbitt at DC Health, out to the rest of the world in ways that we can show them the innovation that's happening here in the District of Columbia. And it also allows us to engage with people who may have never made it to the convention center in the first place. Perhaps there were other barriers. I'm a mom of 2. I have engaged in many more things now, being able to cook and do work and learn at home. And this gives parents and any stakeholder, as we all have a role in maternal and infant health, the opportunity to engage. So we will still have the same main stage discussions that start on tomorrow, as well as the breakout sessions that people can engage with for the rest of the week. And they can also still access them via video if they're not able to make it in real time live. But we know that people really want it. We will have the same virtual expo. We have the same amount of participants in the expo this year where people can connect to resources. And there's so much more to come even after the summit. So I think this is a way for us to be able to engage with all district residents across all 8 wards, as the mayor often mentions, in ways that district residents have told us that they've wanted to engage. So I think it actually gives us a really great opportunity to see how we can continue to be collaborative so that we all can take action towards improving maternal and infant health.
Mark, and just on the idea of gathering again, so Events DC has actually been working to figure out how we present gatherings, meetings, conventions, once again, even though we can't do it in person. And so actually the Maternal and Infant Health Summit will be the first opportunity for us to use a new platform that our partners at Events DC have developed. It's actually called Gather, and what we'll do is we'll be able to actually broadcast a production quality event because we'll be able to be at the convention center and actually broadcast from there with a higher production quality than you would have, say, with a reporter on the rooftop of their residence reporting out. And so we're excited to have that new production quality. The Maternal and Infant Health Summit will be the first event that happens at the convention center. This is the first time we're having any sort of event at the convention center other than, or since the pandemic started. And then we'll also have this weekend the Rammies, which, as you know, is the annual event for the Restaurant Association to recognize outstanding operators and restaurants throughout the region.
And so how many people are going to be in the building when you have those events?
Yeah, so it'd still be within the protocols and the guidelines of the DC Health. So even for, we'll have a smaller footprint for the Maternal and Infant Health Summit, where we'll be well less than 50. And then I think with the Rammies, they'll go right up to the level of 50 because they'll have a few more presenters and things. What they'll do is, in order to stay below that limit, also do for the Rammies, they'll do some pre-produced segments of the program so that they can, even when they have the live event, they could stay well within the DC Health guidance.
And did they have to, other of these events have to apply for waivers or anything to do this?
No, because they're staying within the guidelines of DC Health, and they're also an opportunity for us to do broadcasting, which, as you know, is part of the allowable essential functions.
So thank you for that question. And I want to thank Deputy Mayor Falchicchio for highlighting the work of Events DC to utilize their expertise in events planning and adjust to the COVID environment. So we think that will become a critical part of their portfolio throughout our response to COVID. So we appreciate that. You can still sign up for the Infant and Maternal Health Summit. The main stage as Faith, the presentation is tomorrow at 2:15, I believe. I will be on a panel along with Dr. Fauci, Representative Robin Kelly, and others. So please sign up for Maternal and Infant Health. And you have expanded opportunities because now, instead of just being one half day, there will be events scheduled over 4 days. Thank you, everybody.